Not everybody who's depressed looks depressed. Some people are very good about keeping it hidden.
I see trees of green, red roses too. I see them bloom for me and for you, and I think to myself, what a wonderful world.
Hi, LaVerna. My name is Sandy McGatha, and I am a clinical social worker. I work with Arrow Senior Living. My job consists of helping families and residents, as well as employees of Arrow Senior Living. And we're kind of doing this today to talk about Mental Health Month, which is in May, and to kind of focus a little bit on depression today. Can you tell me a little bit about yourself, LaVerna? Say your name and what you do.
My name is LaVerna Yarnell, and I live at Rock Creek Senior Living here in Ankeny, Iowa. And I have been here about, since Thanksgiving, I guess. And I was very, very ill. And my husband was very ill. And so we both came here to Rock Creek. And in the meantime, he passed away of a massive heart attack. And I am here with his guide dog, or his, not guide dog, but service dog. He was diabetic and had bad heart and all kinds of things. And she lives with me now. So she was very traumatized by his death. And so she doesn't let me get out of sight. So I've got her here beside me. So
I'm glad you have her. What's her name?
Her name is Sugar.
I'm glad you have her. I bet she's glad to have you too.
Well, yes, she doesn't let me ever get out of her sight. And we're having a transition time, but it goes better every day because I get better health-wise, and she is getting adjusted now. She's stopped whining and crying, and she's getting so that she can function well. She's kind of become the dog here where everybody loves her, and they almost fight over who's going to get to hold her leash. We go to memory care every day and visit all the ladies there. And
I'm so glad you're able to do that. I'm glad you have each other as you go through some of this.
Yeah.
Well, the topic today that we're talking about is depression, and kind of navigating what that feels like. Can you tell me how you would define depression? What you think it might be?
Well, to me, it's a feeling of maybe great sadness and not knowing, how to make myself feel better,
Mm-hmm.
And I've kind of gone through that since my husband passed, and wondering what my purpose is, and I guess I've really been searching for that after I got over being so sad about his dying, and everything. Like we just, I come to the fact that you got to go on, and it's not always easy. And I did seek medication. I have an antidepressant that I do take. I was finding that I was, even before he died, I had a terrible accident and had rotor cuff and broken arm and all kinds of stuff, and digestion. I lost over 100 pounds.
Oh,
just
my.
because I couldn't digest my food and things. And my husband was a veteran who had suffered from Agent Orange in the Vietnam War. We were married when we were very young, and when he was 19, he was exposed to Agent Orange. And so he had severe health problems all of his life. And so we had, we've had some depression.
So you really did a great job sharing there. Thank you. And telling your story and also talking about depression. And you are right. Some of those things, it's very sad. There's that feeling of uncertainty, the heaviness, the lack of desire to do things. In your case, there's probably some grief mixed in. I mean, how many years were you guys married?
53.
How
So
many?
we
I'm
were
sorry.
53.
Wow,
5
53
3.
years.
A long time.
You don't see marriages like that nowadays. That's amazing.
Not too often, but we both were very committed to our marriage vows. You know, it really meant something to us. And till death do us part was always something that we held in our heart. And we did love each other an awful lot. And we
Yeah.
did some wonderful things, some wonderful traveling and things, but there were many times that were very difficult.
Sure, sure. I appreciate that you shared a little bit about medication because I do think sometimes when you have depression, that is a chemical change in your brain. There are physical changes as well, and sometimes medication will help kind of raise
Mhm.
that mood, kind of adjust your mood, which I think is very good. Has medication helped you?
Oh, yes. I got to the point that I just, well, after my accident, and there was other times in my life that I took medicine because I had a long medical history, but
Mm-hmm.
the most recent was when I had my accident. And uh, I had no idea why, but like I hadn't seen our dog for a long time. I was in the hospital 3 weeks at home, and my son brought the dog to see me, and I couldn't even hardly pet her. I just cried. I just cried. And I wasn't particularly sad. I think it was happiness, but I just couldn't stop crying. And I had that a number of times. And during that time that I was not feeling good at all, and in a lot of pain and stuff. And finally, my doctor had taken me off all my medicine and tried to start over and get things, working. And so I begged for the medicine back, and she gave me I can't even remember what it was called, but she gave me medicine and low dose, and then we did increase it as time went on until it was the right dosage for me. So.
I'm glad you didn't settle for feeling that way, because I think that's one of the other important things that we really want to make sure that people understand is depression doesn't have to be a part of your normal life. It's something that you can fight. It's something that you can address. Sometimes, I don't know if there's necessarily a cure for depression, just like maybe there's not a cure for diabetes, but there are treatments just like there are for diabetes. You can do a medication, like you said, a low dose or something that helps stabilize the mood. You can get out and exercise a little bit. That helps. Therapy. I used to do therapy in a community mental health agency, and I would talk to a lot of people with depression. There are things you can learn through different theories and practices to kind of help adjust and adapt your mood as well. And you're in a kind of a cool place where you have a lot of support and people around you that you can go visit and take your dog to memory. I mean, that's excellent stuff. You're doing all naturally, instinctively good things, LaVerna.
And my daughter keeps telling me that she thinks exercise helps me so much. I carry a phone in my pocket all the time, and I try to do at least 5,000 steps a day. And,
that's more than I do. Good job.
I don't always make it. Probably twice a week I make it, but I get pretty close. And
exercise releases
make my mind work better, and my happiness, or what you call it, my mood, I guess.
Yeah, elevates your mood. Exercise is a natural endorphin. It sort of releases some of those feel good kind of endorphins. So that's a natural thing. Sitting in the sunshine, and soaking up some sun. One of the things that I think has been really helpful is, just sitting there and just really being in that moment, especially if you're sitting in the sun. Think about how it feels on your skin. What do you see? How does it smell out there? Touching your dog. I mean, just, the textures, you're hitting all those senses, and it kind of helps to sort of just bring you back into the moment and ground you. So I'm really impressed with how well you've done. I know it hasn't been easy. I know there's no way it's been easy to do the things you've been through. So but it
I
sounds
find
like you have
that
natural.
the place where I live here is very pet friendly. And of course, my husband needed the service dog because she saved his life a number of times. The last time when he had his last attack, she ran and got the nurse, and they could not revive him. But I find that, that having that pet is so reassuring, and you you know it's such a neat place to be able to live here where they let you have your pet. And I'm not the only one. I mean, I know several people who have cats and other dogs, and I think that's probably it. I don't know if there's any other kind of animals here, but mostly cats and dogs, and it really makes a difference in the
It would be a
people's
huge difference for me. A pet is a great therapy piece.
yeah.
It's
Oh,
company.
yes.
And then the fact that your dog was so attached to your husband also makes her special. So
Yeah, yeah.
that's very cool too.
And I find that one of the things after he was gone that has really helped me is going to memory care, because it gives me a sense of worth to be able to make them so happy, and be with them. And yesterday I took the dog there, and the lady was a lady was very scared of the dog, and I said, well, you could pet her. No, 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 she's big. She kept saying it. Finally, I noticed she was putting her hand down really close. And then pretty soon she leaned her head way down and got right next to the dog, and Sugar kissed her, give her a little lick on the cheek. And she said, oh, she kissed me. She loves me.
That's right.
And then
Sugar sounds like a good girl.
just petting and petting and petting her. And I went away feeling so fulfilled. It makes my depression go away, or my sadness, So
Again, a natural thing to do when you feel like that is to get out a little bit and maybe give to someone else. So again, very good for you to be
I
thinking
think
that way.
pulls you out of your, I thought I was going to die before my husband because I was really sick, and here I am every day, just a little bit better. And a lot of it is just the positiveness of being in a community like this and being able to go to the dining room and eat with other people and just interact. And there's so many, it's a neat place to be. I volunteered a lot before I was sick in like a rest home, and did chaplaincy at the hospital and things like that. And that was always good. But this is just a different situation where everybody seems to support each other and hang together. It's really neat.
It's kind of like a different kind of family, but still a family of people.
Yeah.
Can you tell me, what are some misconceptions that you can think of that people might have about depression? Do you have any ideas?
Well, I think a lot of people are ashamed, or think that it's really something horrible. And I don't know. I think if you have to take medicine, it used to be that was really something you tried to hide. You didn't want people to know that. But I don't think really it is anymore. I think most people are pretty accepting and understand. I have a lady that I know that's was a nurse's aide, and she has just recently been diagnosed with some, I'm not sure with what, but everybody just encouraged her and was, it wasn't a shameful thing at all. And in my day, well, I don't know how many years ago I would say, but I suppose 50, 60 years ago, if anybody had a mental or depression or acted just a little bit different or something, or had to have medicine, or, well, they didn't even have medicine back then, I don't know. But it was really a big deal, and most people didn't want anybody to know, but it's different than that now.
You're absolutely right. As someone who works in mental health and has for the last 20 years or so, and that's what Mental Health Awareness Month is to kind of bring out the fact. But, a lot of people, actually probably all of us at any given day, could say we have a mental health issue, depending upon our resiliency, how much rest we've had, what we're facing in the world. I think it's a very stressful world. We just went through 2 years of COVID, for goodness sakes, and that was stressful, causing anxiety and depression and worry. And usually if you have depression, there's a little bit of anxiety sort of keeping it company. Not in all cases, but a lot of times you'll notice that, because there's that sense of, am I going to be okay, or can I manage this? And so you hit some really good points. Some people believe you can just snap your fingers and get over it. That's not necessarily true. And I like the fact that you said that people don't talk about it, but by keeping it in the dark, it makes it a lot harder for people who could use the help or who want to talk about it. And because this company works with seniors and we work with communities like your community, it's important to realize that it's not, don't accept it, fight it. That's not, just aging doesn't mean that you have to feel depressed or sad. There's so many great things that are still out there to do, just like you found.
I know a lot of times people, well, even in my church, I remember a lady, my daughter was very sick, and I was really discouraged about it. And she said, well, just pull up your bootstraps and go on, And I said, well, I just wish there was somebody I could talk to see if I couldn't get help for her, because she was very sick. And she said, well, that's not how it's done. You pull up your bootstraps and just go right on. And I tried that, but I don't think it was very successful.
Well, depression can be very lonely, and being able to talk to somebody else allows you to sort of realize that you're not alone, that maybe somebody else understands. And in fact, that sometimes is all people really need, is to not feel alone about it. And then realize that you can learn things about it. You can do things about it, just like you've done, kind of get busy, go out and sit and talk to somebody, have a pet. Pets are great therapy. I'm a big proponent of that. And then reaching out and volunteering and helping. So good job. There will always be those who say, pull yourself up by your bootstraps, or it's not real. But as a person who works in mental health, I'm going to tell you, I think it's very real. And I think it's very manageable, but you got to first acknowledge it.
Yeah.
So what are the things that you like, if you had, what advice would you give to someone who might think they have depression? What would your advice be to them as someone who's conquered it or managed it?
Look and find some way to talk to someone. In my community, I was from Kansas before I come here. When I had my accident, I was in hospital in Kansas, and my daughter brought me up to Des Moines. And but we had like mental health, community mental health in our community, and I just reached out to them a number of times. So, well, I had taught for a number of years, and I have referred, kids to the mental health clinic and things. But I, reached out to them myself, and there's some really fine people. Most people that are in mental health are very caring and loving and helpful, and if you reach out and ask for someone, that you can find, maybe your first person you pick might not be the one that is going to really help you, but if you hang in there, and maybe you have to try another therapist or something once in a while. But
yep, it's important to find somebody that you click with. What part of Kansas were you from?
North Central Kansas, right up on the border. We were in between Denver and Kansas City, just almost exactly on Highway 36, which was right up to the Nebraska line almost.
Okay.
And not a lot going on there, but
That's okay. I kind of like it. I'm in.
We were 10.5 miles from the nearest town over 2,000. And well, I suppose 10.5 miles to 2,000 population, but anyway, we had an outreach from like a bigger town, and we had a mental health clinic right in our town, and it served a lot of people and did wonderful things. So
Yep. Community mental health, they're here. That's where my last job was in community mental health, doing therapy and working with individuals in substance. And so I do believe that it is real. And I do believe that we all have a calling to help out, and that there's need. And, actually they say the golden standard is to probably medication and therapy for a while to kind of work them hand in hand. And then just helping people sort of reconnect back to their resources, good family supports, and avoiding alcohol and drugs. Always, if you can, avoid alcohol and drugs, because alcohol is a natural depressant, which doesn't help if you're already having depressive feelings. I think about the different kinds of depression and how many different kinds. I was actually surprised myself when I looked up how many different kinds of depression there are.
I wouldn't know that.
Well, there's kind of a situational depression, which means it's probably kind of fleeting. It'll be there because of something that's happening, maybe a sadness, but it's not necessarily a long-term one. There's a major depressive disorder, which actually is one that is diagnosable. It's a part of the DSM criteria, and that is kind of designed for people who have longer-term mood disorders that probably are maybe chronic. Persistent, depression is also known as dysthymia. It's kind of a longer term chronic, kind of a lower range, but it's one of those feelings that you kind of feel at least 2 years or more. I mean, that's one of those that people feel. Seasonal affective disorder. Have you heard of that, LaVerna?
No, I don't think so.
That's actually nicknamed it SAD, but it's a part of, a lot of people feel it in the winter as the days get shorter, there's less sunshine, and they notice that there's just not as much that vitamin D that you get from being out in the sun. That's important. But SAD is one that sort of happens in the winter months. It gets better in the summer when there's longer days, brighter days.
People have that problem. I didn't know the term.
There's actually a name for it. There is. And then there's like postpartum depression, which we know some people may have after the birth of a child.
Yes, I had that.
Did you?
When I had my first child. And that was another time a nurse told me, just suck it up, honey, because lots of people have a kid and you're going to have to rest now so you can take care of this baby when you get home.
Yeah. And you probably did. You probably got up and you probably took care of that baby. But telling you to suck it up probably wasn't the best advice.
I remember crying all night long. After she told me that, I asked her if she would rub my back, as my back hurt so bad. Well, she said, I got things to do and you better just suck it up. And anyway, it went away pretty quickly when I got that baby home.
Well, sure. It sounds like you've been like this great advocate. You even help people. You said as a teacher, you were a teacher and you sort of helped other students.
I started out when I was a junior in high school. I was in the youth service corps, which I worked in an institution for mentally disabled people. And then I just kind of got caught, being enthused with that kind of thing. And I taught special ed for a while until I had my own children. And then it was a little bit too stressful to have your own children. And, work with kids that were, really needed a lot of extra, like I'd have to go make home visits all the time and all that. And I did enjoy that. But when I had my own children at home, I really felt, I even had one parent ask me if I would just take her child. She said, I think maybe you could raise them because you know about things like that and you can just have them. I said, I don't think so, but I wasn't ready to take that on. I was just, pretty young for that. But anyway, then I taught for 35 years. And when I retired, I went back to school to be I wasn't an ordained minister, but I took 3 years of classes so that I could do chaplaincy and, things like that. So
you seem to be called to be helpful to other human beings to be aware of what's going on in their lives and to be there for them. That's really cool, LaVerna.
Well, I have just been exploring that just recently because, with the loss of my husband, and I cared for him all the time, and then all of a sudden I didn't have that, and it was just like, so many things in my life were just changing. And I come across, and I can't, I have a terrible memory, but I can't remember the name of the book, but it's written by a man who was in the Nazi concentration camps when he was a little boy. And I know that I heard about the book from a man who studied this author when he was in school to be a psychologist.
Mm-hmm.
And it's your the fulfilled life or something like that, where when you the people in the he studied the people in the concentration camp, and he watched them. He was a little boy, but he still watched them. Some of them come in and they looked like they were just going to die, and he thought, well, they won't be around very long, but they would live on, and people would come in real healthy and they would die right away, and he was always saying to himself, as he grew up, how can this be? Why does this happen? And he said they have a purpose. They have a place in life that they and it isn't them. It isn't all about them. It's about somebody else. And that's what helps them keep on with their life and be healthy, or make a
difference.
On. Yeah. Mm-hmm. And I just have really thought about that a lot, because I'm here and I'm thinking, well, what is my purpose? My husband's gone and all of that, and I need to find a purpose, and what is my purpose? Well, I prayed about it a lot, but I just kind of found that just, like being like volunteering to do this, or going to the memory care, or
maybe telling your story here today,
committee or something like that.
And telling your story here today was great.
Those things give you purpose.
Yeah,
and
absolutely.
if you don't have a purpose, if you sit in your room and watch Hallmark movies or something all day,
which are not all bad on certain days.
No, they're not. But
get out of it.
Are you fulfilling a purpose when you do that? It's kind of good to, good to find that.
Absolutely. And going back to work on ministry, that's very interesting that you're doing that.
Yeah, well, it would just kind of come naturally, I guess. But,
yeah. Just like watching other humans and being there for them naturally for you.
I did have a church for a while. I was at a church. Well, it was my home church, and the pastor left. And I worked there for about a year. And then all of a sudden I got very, very ill. And I really had a hard time understanding. I felt that I was called to do that. But then I became too ill to do that. And so that purpose then was gone. I just didn't know what I was supposed to be doing. But I worked through that too. So I guess we are challenged every now and then.
Yeah, exactly.
Yeah.
Exactly.
Yeah.
What other things? I'll share a few things, and I want to know if you would share a few things that you would like people to know about depression. If you had to give them just a few gems of information, what would you share?
Well, I think the main thing is that you aren't different from anyone else. That many, many people suffer from depression, and it's a normal thing, But don't just push it aside or handle it within your own self. Reach out to someone, and hopefully it doesn't have to be a mental health person, but that's a very good person to reach out to. But your pastor, good friend, somebody.
Excellent.
that will
Excellent.
send you in the right direction, that you trust. And, there's some people that are pretty kooky. And you don't want
I
to
think
ask just anybody off the street, but, people that you trust is good.
excellent advice. Excellent. I would add, you said your pastor or some friends. You could also talk to your general practitioner, your provider. They may have some suggestions. The other things I would add is not everybody who's depressed looks depressed. Some people are very good about keeping it hidden, but that doesn't mean that they aren't struggling a little bit. You just may have to help them a little more share, because like you said, there used to be stigma attached to it. And in some cases there still is. So not everybody wants to share that. So I always thought that was interesting, that not everybody looks depressed, even if they are. And that there's sometimes a component of anxiety attached to it, which makes it a little harder. And depression can be linked to other health problems. So it's important to pay attention to your health, because you are connected in the same body, your body and your mind, and keeping all that kind of organized is very important to the overall health of a person. I think those are some of the points, and you've been excellent resource to share your information, LaVerna. I really appreciated this time with you.
I did offer something that was useful.
Oh, you absolutely did.
I really
absolutely
enjoyed doing this. It was fun.
Well, I appreciate your time, and thank you so much, and I wish you a good afternoon.
Oh, you too. Bye-bye, Sandy.
Bye, LaVerna.
And I think to myself, what a wonderful